myself again, Vasna Ramasar, and I'm representing the Lund University Centre for Sustainability Studies, where we've been working as one of the Right Livelihood colleges. You would have, I hope, a copy of the report, and I hope you will have a chance to read it, and maybe we can have some of a discussion about it later. But what I will do now is run through a bit of the report and maybe offer a bit of the context to the presentations that we've had from Nino, from Hans, and from Frankie as well. To start off with, what I'd like to just enter our discussions with is a recent editorial that was presented in Science, a very prestigious journal. And it was from the National Institute of Health in the US by the director of the US National Institute of Allergy and Infectious Diseases, as well as the director of the NIH in total. And this is a quote. I can use this. There's a quote down here which says, "Engagement in global health protects the nation's citizens, enhances the economy, and advances US interests abroad." As you can see, that's a very internally focused idea of what global health is about, what global health should be achieving, and how we can go about doing it. And what I'd like to suggest in the report and the presentation is that we need to take a broader perspective on global health and really look at it in context of a broader system that includes the environment and climate change. So the report, as I've mentioned, is something that was presented earlier at the Swedish Parliament, and what we'll do today is just run through some of these topics. What's the relationship between health and the environment, some of the issues around inequalities, and then focusing on where we can move forward in terms of co-benefits and a rights-based approach. I have to start by saying that in terms of our global fight against ill health, morbidity and mortality, there has certainly been a number of improvements in this area. But what we've also seen, and what Hans has alluded to, as has Frankie, is that there's been shifts in the way, in sort of the leading causes of death and disease in the world. So this graph down here shows the 20 leading causes of death globally in 2012, and the leading cause is heart disease, stroke, and then chronic obstructions in the respiratory system. And that's been a shift from many of the diseases that were at the top a few years earlier. So the global trend has been one that's moved into a society where there's diseases of maybe overconsumption, of not having nutritious consumption, and lifestyles which are riddled with pollution. That trend is global, but it is quite different around the world. So the graph at the top shows that for high-income countries, that trend around heart disease, respiratory disease, things like diabetes are growing. But in low-income countries, and this is the graph for deaths in the African region, we still see issues like diarrhea, preterm birth conditions as being very high. Conditions that have been managed in much of the world, but still cause a large number of deaths. And especially in the world, we see a report from WHO in 2006 suggested that it was a quarter of diseases the environmental burden of disease was caused by the environment. In such regions as this, obviously that's much higher. And when we look at vulnerable groups such as children, it is far higher than that. So how exactly does this environmental burden of disease happen? The IPCC has created this diagram which suggests that we have climate change taking place, and then it affects health through three sort of pathways. The first is direct exposures, as Nemo mentioned, flood damage, 300 people losing their lives in 2 months because of flooding. We have indirect exposures, where we have disease vectors or increased water and air pollution taking place. And then finally, we have the broader constraints of the economic and social disruption. So some of the things that Hans has spoken about of how food production and distribution has changed and affects health through that. And obviously all of these are mediated by the coping strategies, the capacity to respond that exists both through socioeconomic status and public health infrastructure that exists in the world. So there's a complex relationship that happens between climate change and all environmental issues and health. what we are seeing, and we all know that climate change is increasing, and as a result of that, we will see trends of increasing diseases around the world. These maps show projections for 2035, where vulnerability to infectious disease spread is changing in Europe. Particularly, we see down in the southwest and the southeast, particularly down here, that there will be substantial changes in the spread of infectious diseases, things like dengue fever showing up again, which were not concerned previously. And ultimately, what that means and where that is felt most is that it is human life that is at stake because of this. I think this diagram is a very important one because it shows the daily excess mortality from non-accidental causes in Moscow. And what's very clear here is this peak that's developed. That was a peak during a heat wave event in Moscow. And down here, sort of reflecting the number of mortality, the number of deaths, lives lost because of that. So there's clearly links between our anthropogenic activities, the changes we're causing in the environment, and what that means to health. And of course, I need to note that there is a reciprocal relationship as well, where some of the changes that we make to health status will also affect the environment itself. How we dispose of medical waste, for example, is an issue which will change the environmental conditions. We also see that that burden of disease is not spread equally in the world. This map clearly shows that it is largely the global south that carries the biggest burden of disease. It's not just obviously in the global south, but also to recognize that there are a number of intersections that affect people's vulnerability to the burden of disease, including age, race, socioeconomic status, and so forth. Hurricane Katrina reminded us of that in the US. Another point I think worth noting here is when we're talking about things like climate change, is that it's not just that the burden of disease is with these countries, and it's not just about poor Africa, it's that a lot of the practices that we have participated in the global north and continue to foster actually exacerbate the problems here, the ecological debt that comes from the emissions that have been produced in the past. So just to sort of wrap up on this is that there are huge inequalities in how and where environment and health collide, and we need to figure out ways to deal with it which is beyond the current strategies, which still don't favor the people who are most vulnerable. And there are a number of opportunities for us to address health and environment. And key to doing this is being able to shift the focus from seeing beneficiaries of healthcare as being simply passive recipients, but rather as active agents who can actually contribute to both improving the environment as well as improving health. A need as well to move away from a focus on the vested interests of particular groups like pharmaceutical companies, deciding on decisions, deciding on policies, and also maybe a shift in our development approach away from a needs-based approach to something else which is more about a rights-based approach. And that rights-based approach that I would like to recommend and which we talk about a bit more in the report is about facilitating health through people's empowerment. So Frankie spoke about the women in South India, and about the thing that they gained from that was a sense of empowerment, of pride, of what they were doing as being so important. And a rights-based approach is not just about achieving human rights of the right to life, but it's also about the process in which people get involved and how that can be empowering for them and drawing on the agency of various actors. So what we have recommended in the report, as Frankie has spoken about, is the idea that there are many different groups who are dealing with issues of health and environment on a daily basis. And we need to find the opportunities to create co-benefits through actually supporting local agency. In the report itself, we talk through 3 cases of co-benefits. The notion of how do we bring the science that we do into action? How do we make the work that happens out of scientific communities that many of us are part of, something that is actually directly relevant and useful at a local level without great costs involved for individuals using it. The picture that is shown here is a second case study which is around supporting local entrepreneurship and innovations such as a smokeless kitchen. So the woman in the picture is showing a stove that is being used, so one of the cook stoves, where there is sort of a flue chimney that goes outside the house. In the process of using this kind of a smokeless kitchen or cook stove, it's possible to reduce indoor air pollution as well as to reduce the use of biofuels. So co-benefits, both for the environment and for human health. And then finally, I think from what we've seen through the work of the laureates who presented today, as well as a number of other laureates involved in the right livelihoods, is that individual leadership and collective societal action is critical to actually being able to address these issues of health and environment. That it's not left in the hands of a few big agencies or a few big corporations to deal with it, but where can we find the opportunities in what people are doing in their everyday lives. And in doing so, I think we see that there can be huge co-benefits for health and environment. So this, again, a graph from the IPCC report, which shows that when you have things like cook stoves, when you have different ways of supporting people with PV and hybrid vehicles, you can have impacts that support both human health, so health cost effectiveness, as well as carbon cost effectiveness. To end then, I think the notion that we have tried to advocate is that health, climate change and environment is a very complex arena. It is one that is also meshed up into the whole system and the questions that we have to deal with when it comes to sustainability. What we need to do is fundamentally rethink that relationship between global health and the environment. Not as global health and the environment or humans and nature, but how do they actually exist together in society. And then what we've advocated is that interdisciplinary perspective, so bridging health and environment concerns, getting people talking to each other and figuring out innovative ways of making the co-benefits happen. And ultimately, it is about recognizing that at all levels of society that we can realize such co-benefits. So through the report and through the work that we've done, we would like to advocate that we consider a rights-based approach to health as being something that we need to pursue and something which is already captured in the Universal Declaration of Human Rights. But we also need to think about a rights-based approach to the environment. The two go hand in hand, and ultimately they can further both material rights and the rights to transparent, participatory, and empowering processes. Thank you.